Hi, my name's September. I'm going to be your student nurse today. I'm going to conduct a head-to-toe assessment. Is that all right with you?
Yep.
Do you use any glasses or hearing aids?
Nope.
Okay. Can I have you state your name?
My name is Logan.
And where are you?
Hospital.
And who's the president?
Barack Obama.
Patient is alert and oriented ×3. I'm going to have you stand up. And you walk towards me. And then walk away. Okay. Gait is steady and coordinated. Just walk a little closer. Now have you stand on one foot. Stand on the other foot. Okay. So balance is intact. I'm going to have you turn to the side. And then can you make circular motions with your arms? Okay. No crepitus noted in the joint. Go ahead and lift the arm. No crepitus noted. No crepitus is noted. Circular motion. No crepitus is noted. And no crepitus is noted. I'm going to have you swing your hip forward and back. No crepitus. No crepitus. No crepitus is noted. Crepitus. I'm just going to have you tilt your head back, forward, down to your chest, side to side. Alright, so there's full ROM in the neck and all the extremities. Go ahead and open your mouth. Okay, so there's no crepitus noted in the TMJ, and I'm just going to have you turn, and then just bend over for me. I'm just going to palpate the spine. Let me know if you feel any pain. Okay, so no evidence of lordosis, kyphosis, or scoliosis. Go ahead and stand up for me. And then you can go ahead and sit down. You can put your arms out like this. Lift up, push down. Okay, and then your leg. Push up, push down, push up, and then push down. And then with your foot, push up. Okay, so muscle strength in all extremities is +5. And then I'm just going to check the ankle joint for signs of crepitus. Go ahead and circle. Circle. No crepitus is noted. Skin turgor is a good recoil. Capillary refill is less than 2 seconds. Lower extremity is warm, pink in color, and absent of moisture. Skin color overall is of a pinkish undertone, dry and warm. Skin turgor is good in the upper extremities, no signs of tenting. Okay, so next I'm going to have you remember 3 words. The words are going to be cat, pumpkin, and soccer. And I'm going to ask you to recall those at the end. So, can you just touch your fingers? And then go from your nose to my finger 3 times. Gross motor and fine motor skills are intact. And now I'm going to assess the head. The head is midline, sat on the cervical spine. Head is a good size for race and ethnicity. And then I'm going to put gloves on to inspect the hair. As of looking at it right now, hair is evenly distributed, along with the eyebrows and eyelashes are evenly distributed and symmetrical on the face. So there's no sign of any lesions or deformities. on the head, no critters. And then let me know if there's any pain or tenderness. Any pain?
Nope.
Okay, so there's no pain in the sinuses. I'm just going to palpate the ears for nodules or lesions. No nodules are present. Okay, so I'll leave these. And I'm just going to palpate for your lymph nodes. Let me know if you feel any pain or tenderness. Any pain? Okay, so there's no tenderness or pain noted in the lymph nodes, and they don't seem enlarged. I'm going to inspect your ears. There's no drainage noted, no impacted cerumen. Do you have any difficulties hearing at all?
Nope.
Okay. And so like I said, your eyebrows are equally distributed. Eyes are round and symmetrical in size. Sclera is white, conjunctiva is clear. Irises are of a green color, and pupil size is 4 millimeters. I'm just going to have you look at me. Okay, and then just follow this in. Okay, and then just follow the top of the pen. Okay, so no nystagmus is present in accordance to the 6 cardinal fields of Gades are intact. Pupils are equal and reactive to light and able to accommodate. Are you having any issues smelling at all?
No.
Okay, so nares are the same size bilaterally. There's no evidence of drainage. The nose is midline and symmetrical. There's no evidence of cyanosis around the mouth. Lips seem moist and pink in color. Now have you open your mouth. Stick your tongue out. Say ah. Uvula is midline, and there's presence of tonsils, but they're not swollen. Can you open your mouth? Mucosa is pink and moist in color. No evidence of dental caries, and it's well hydrated. So the next thing we're going to do is, can you recall those 3 words for me?
Soccer, pumpkin, and cat.
Okay, so short-term memory is intact. And the next thing we're going to do is assess your pulses. So I'm just going to check your carotid. Okay, so carotid pulse is 2+, bilaterally. Rate and rhythm are equal, and then just I'm going to check your pulses here. Pulse is equal in rate and rhythm, non-bounding. And then I'm going to have you just sit up straight for me. And I'm going to listen for your lung sounds. Go ahead and take a deep breath. Go ahead again. Okay. So, lung sounds are clear bilaterally, no evidence of crackles, bronchi, or wheezing. Can I have you stand up for me? And then just turn to the side. And go ahead and take a deep breath. Okay. Let's try one more time. Lung expansion is equal bilaterally. Go ahead and sit down. Okay, next I'm going to listen to your heart sounds. And I'm going to be listening to the valves, so your mitral and tricuspid and the apex of your heart. S1 and S2 sounds are present. There's no evidence of rub, murmurs, or palpitations. I'm just gonna palpate your chest and let me know if you feel any pain or tenderness. Any pain, tenderness at all?
No.
Okay. So there's no evidence of pain or tenderness in the pericardium. Next, I'm going to have you puff out your cheeks, smile, frown, raise your eyebrows, and then go ahead and just push up. Okay. So all cranial nerves are intact. Are you having any difficulties with taste at all?
Nope.
Okay, so patient says that there's no difficulties in taste either. Next, I'm going to check your abdomen, so can I just have you lay down? Okay, I'm going to lift your shirt, and I'm going to listen for some vowel sounds. Vowel sounds are present in all four quadrants, neither hyper or hypoactive. I'm going to listen for your vascular sounds. No swooshing is present, indicating that there is no cause for concern for an aortic aneurysm. I'm just going to palpate your abdomen. Let me know if you feel any pain or tenderness. Any pain or tenderness?
No.
Okay, so patient states there's no pain or tenderness when the abdomen is palpated. I'm just going to check for your pulses. Dorsalis, pedalis pulses are equal in rate and rhythm bilaterally, non-bounding, with a strength of 2+. Posterior tibialis is equal in rate and rhythm, non-bounding, bilaterally, with a strength of 2+. You can go ahead and sit up for me. Okay. And that's it.